Bismillah wa salatu wa salamu ala Rasulillah. Welcome back to the Revert Radio Show. The Revert Show, as you usually know and hear, that we start our show always with the name of Allah, the Most High, the Most Merciful, the Especially Merciful. Praise Him, we thank Him always, because He is the one that is deserving to be praised, and He is the one that is deserving to be worshipped. We are here today sitting with brother Dr. Mohammad Saleh at his office, the addiction office and general clinic, talking about information that is necessary for us to know, information that needs to be well known by everybody regarding addiction. Addiction is a common problem that is happening in this country, at least, all over the world, of course. But since we're here with brother Dr. Mohammad Saleh, we're going to take as much information as we can regarding this, bi'idhnillahi ta'ala. Start off by introducing yourself, Brother Muhammad, to everybody. Jazakallah khair.
My name is Dr. Mohamad Saleh. I am a family physician, board certified. I'm an addiction specialist as well. I'm here to enlighten you with information about addiction, and maybe at the end some information about coronavirus. As a family physician, I am open to any questions, and I'm here to really educate you about addiction and how we treat the patients and how we can help to fight this epidemic crisis about opioid abuse and the consequences of addiction if not treated.
Okay, khair, inshallah. Jazakallah khair. So, number one thing, we want to know what causes addiction, regardless of what the drug is or the substance that people are using, because people can be addicted to other than just actual bad drugs, of course, right?
True. But let's define first addiction. Addiction came from a Latin word which is addict, which means the patient is a prisoner of a material. The patient cannot live without the material. This is addiction. The president, at the beginning of middle of last year, he announced that we have epidemic crisis of opioid addiction, which means people are addicted to the opioids. Now, if we put that aside and let's say, what's addiction? Addiction is a disease. A disease. It's not, but people think it's low morality or bad person, or that stigma around addiction. It's completely wrong. Addiction is a disease, just like in hypertension, like diabetes, and the diseased person it's a multifactorial thing. By mean, I can give a certain drug to a person and he will never be addict to it, and I give the same drug, same dose to another person, but he will become addict to it. And that's variation makes it a disease. So, that being said, we have to know that the factors, the factors which make the patient a diseased addiction. One of these factors is the environment. If you're exposed to the material and unnecessarily exposed medically to the material, or you've been exposed to the material through your friend or through street dealer, that's the environmental factor. If we eliminate the environmental factor, we will eliminate the disease. The second factor is genetics. If you have family history of addiction in your family, you're most probably going to be also prone to addiction. The third thing, the age. The younger you become addicted to a material, it will be hard to treat rather than in your 30s or 40s or 50s. So that's being said, that's why we like to screen always the younger people for addiction more than the adults. Now, what happened with addiction? When you take certain substance, let's say like opioid, it produces abnormal chemical reaction in your brain, which is euphoria, which makes you happy. And you like that feeling. And that feeling is really addicted. You want to experience it again and again and again. And all of a sudden, after a certain period of time, you start to feel that your body is asking for the material. And when you decide, I'm not going to take the material, I don't want to feel that feeling again, you start to have withdrawal symptoms. and that makes you need the material just to compose yourself. Now you are not needing the material to really get that feeling. You need the material just to compose yourself and not go in withdrawal. And we call that the black hole of addiction.
Oh, wow.
And when you get to that black hole of addiction, the chemical of your brain changed. So your judgments are changed. Like you think that stealing money from your parents is okay to get the material, so you stay composed. Yes, and this is again a disease. You are not criminal when you do that, but it's a disease where your chemical brains changed and your judgments changed. And here when you need the treatment. As soon as you get to the black hole, you need to get help. And this help is multi-specialty help. It's not one direction help. I offer only the medical assistant for addiction, but you need also therapy to help you to identify the reasons why you turned and why you turned to addict. And we have very successful rates when we really look at to this disease from multiple views, and we coordinate the care to help the patients to stop being addict and to get normal back to your life. Addiction is a very severe disease, and you need help. My recommendation for the families, you have to screen your kids for the addiction. And you don't have to ask them any question. You just have to monitor their behavior. And two things you have to monitor: their money. I'm not asking you to give them this money or anything like that. You can give them whatever you want, but you have to know where the money goes.
You have to be wise
yes.
about it.
How they spend their money. The second thing, if your kid is trying to have excuses for any family gathering, because the first thing for the addiction patient start to do is he wants to be alone. He doesn't want to be in front of people with any gathering. He always wants to be by himself or the people who share him the same addiction habits
and usage and stuff.
Yes. So if he miss all the family gathering, then there's something wrong going on.
Definitely.
If he stop his sporting activities, that's a bad sign. Why he stops going to his practice? Then you have to investigate. For the adults, my advice is, if you feel that you started being addicted to any substance, alcohol, opioids, narcotics, benzos, sedative medication, it's time to come forward and ask for help. We will screen you and we will have criteria. If you meet the criteria, we'll start the treatment. If you don't meet the criteria, we help you to stop and taper you from this substance to be cleared and your system free of any substance could really, in the future, to fall in that hole of addiction. That's the whole thing about addiction.
May Allah subhanahu wa ta'ala keep us away from addiction, keep our families away from addiction, and from all bad things altogether.
Sure. Praying in the mosque is one of the gathering. If you start losing one of your friends beside you, you have to ask why. Because of course the addiction will prevent him from gathering and prevent him from coming to the mosque. So it's another sign that you really put it in your mind why he dropped the mosque, why he dropped his activity.
That's a beautiful That's a beautiful thing about having the revert family, the Muslim family in your life. You got people who will look out for you. You got people who's asking about you. You got people who's checking up on you frequently. So you come to the masjid frequently, and then all of a sudden you drop off. Everybody's gonna be like, "Yo, what happened to the brother? Where's he at?" So that's definitely important for us also to keep checking out on our brothers and asking about them. And if somebody is sick, we go visit them. As we know, the Prophet Muhammad Saleh told us that it's a great reward for those who go visit the Muslim brothers who are sick, or even they don't even have to be sick. You just go visit them just because they're your brother in Islam. So this issue of addiction or being addicted to something is major. It's definitely a major situation. Brother Dr. Mohammad Saleh here, he summed it up in a very, very short way and very brief way, so we can use the time, alhamdulillah. But you definitely have no other options. If you have any type of addiction, the only option that you have is to come to places like this place. There are many, alhamdulillah, but this place, alhamdulillah, we're talking about it. We're here visiting it. They have a good facility. They have full staff. They have the doctor, mashallah, with great equipment, with great knowledge and information that can help you get yourself away from those addictions. Because addictions also come from bad habits,
True.
from stuff like that.
True. Again, I don't want to scare people, but addiction is a serious disease that can cause death. And actually, 2018, not 19, the death from opioids overdose was exceeding the number of deaths from from accidents.
Allah Akbar.
Which that's why the president announced it. We have epidemic crisis. Again, it happens. Yes, it happens, and because of lack of information, lack of education, people overdose, taking too much medication, just try to trace that feeling of the happiness and the euphoria thing, and that amount is enough to suppress your brain and put you in coma and die.
Allah Akbar.
And this is what we don't want. And
Wow.
the second thing we discovered, that the drug dealers are mixing the drug you're buying with some other materials you don't know about, which is called fentanyl, which
Keep you addicted more, huh?
keep you addicted more. But
Wow.
the only problem is fentanyl. When you give fentanyl to a opioid naive person, it's enough to kill you.
Wow.
2 grams is enough to kill you.
Allah Akbar.
It's a very small amount, enough to kill a person through respiratory depression. So again, please, I cannot emphasize and really push hard that addiction is a disease. It's not low morality. It's a disease, and when you have a person who's diseased, he needs your sympathy. He needs your help. He doesn't need your judgments. He doesn't.
That's right.
He doesn't need your advice. He needs you to help him to get the proper care and to get him out of that black hole he's in.
And is it true to say that some of those addicted people know that they are addicted? They know that they have a disease, but they just can't help it.
True. The stigma around it. He cannot. First of all, the addict peoples, they know they're addicts. Some of them are in complete awareness that they're addicts, but they are very shy and they are really scared of their family to come out and say, I need help. I have addiction to alcohol. I have addiction to narcotics. I have addiction to pain pills. But I will give you an example, which is real example.
Real life.
Yes. We have a material in the nature, it's called carbon.
Carbon?
Carbon, yes.
Uh-huh.
We found it in mines. If we put that carbon in a great stress of pressure, water pressure, heat pressure, it crystallized into diamond.
Subhanallah.
And diamond people like to keep, and people spend money to keep it. And people always brag about it, and they put it in the rings, and they keep it in the safe. But the same material can be also exposed to the same pressure, but it turns into graphite. Graphite, we make pencils.
Oh,
Pencils,
like
which
the
is-
lead.
The lead, yeah,
Okay.
The lead is carbon, 50 cents. You break it, you don't care about it, you keep forgetting it, nobody asks you about it, you can give
So
it
you do
to
the same
somebody.
procedure to it. You have 2 different things.
Yes, same material.
2 values, 2 different values.
Yes, so we are human beings. We can be exposed to the stress, and we have the choice to turn into diamond, and people will love us and will keep our relationship with us, and will always be proud of us. Or we can turn into graphite, where people will care about us, and we can be easily broken, and we easily be forgotten,
No value.
and it with no value at all.
Right.
So this is my message to any person who thinks he's an addict. Please, it's the time to make the choice to turn into a diamond, to get treated, to get free of substance, to get back to your life, to get back to your normal relationship, to get back to your work. Because the addiction is a disease, should be treated, not should be ignored. And it really consumes all your brain cells to think about the material. You don't care about your work, you don't care about
Yeah.
your relationship, you don't care about how you're going to get the money. All you care about, since you open your eyes in the morning, how
I
I'm going to
get
get
that
the
stuff.
material,
Yeah.
who I'm going to use it with.
Who you gonna call? Who you gonna
Yes.
party with? Who you gonna
And,
do all
and
that
this
stuff
is
with?
not right. Again,
Mhm.
this is a change of the chemical in the brain, which we need to reverse it to get you to a normal life, normal person, with surrounded by the loved ones, and you go to your work, full functioning,
Normal life.
normal life. Yeah.
So, what would be, on average, the time frame that is estimated for you to be able to help somebody get away from an addiction?
Right away. As soon as I diagnose him, the right diagnosis with addiction, and know the material, there is now breakthrough through the treatments that the patient can be functional within 48 hours.
Wow.
48 hours.
48 hours.
They
Allah
can be
Akbar.
functional again.
Amazing.
Yes.
So they could be addicted to heroin, they could be addicted to cocaine, opioids, whatever it is that they're addicted to.
Yes.
In 48 hours,
Yes.
they can be functioning normally, inshallah.
Yes. There is injectables now, which inside their bodies for 30 days that cut the cravings, keep him composed, no need for the material at all, and he will be completely sound, his judgments will be changed, and he can be back to his normal life right away.
SubhanAllah.
Yes.
Back in the day, they used to say it might take months for somebody
but thank God now we have new technology in addiction that we can treat the patients outpatient, even he doesn't have to go to rehab. But again, it's a decision of the person again to turn from a pencil to a diamond.
To a diamond.
Yes.
Yeah, you heard that right, man. For real. This is real. This is real life. This is real stories. People are being addicted, and people are addicted. People are turning into these substances. First of all, maybe to relax, maybe to get their thoughts off of this dunya or off of this life, all these problems that they have. But they can get into addiction by getting into those bad habits and stuff. So be careful. And if you or somebody that you know turned into these things, then you know you have solutions. You know you have options. You're not stuck. Because as he said, there's a black hole that you might get into. And once you're into that black hole, you're only chasing your high. Just chasing and chasing and chasing. It's not stopping. And then all these withdrawals will just keep getting back at you.
Yeah, get back at you. You overdosed and then you die.
Yeah, well, how bad is that? Dying with an addiction, facing Allah, the Most High, with this disease that you put on yourself. It is a disease, but you were the cause, you were the reason for it. May Allah subhanahu wa ta'ala forgive me and you and all of us and keep us away from all these bad things. Allahumma ameen. So you have it right here, right now. This is an office for you to come and visit Brother Mohammad Saleh. He's got the office right here, NEU, New Clinic. Give him the phone number, give him the address.
Neu Urgent Care, it's located in Hazel Park, 624 East 9 Mile. Phone number is 248-629-7497. Again, 248-629-7497.
We'll have the information and the details, inshallah, in the bottom with the website, with the location, with all the information. And you've already heard the commercial a few times already, alhamdulillah, for 2 consecutive weeks, hearing about the Neu Urgent Care, alhamdulillah, Rabbil Alameen. You know, this is the place to be. This is the place you want to come and check out by the will of Allah subhanahu wa ta'ala. Get yourself taken care of, inshallah.
Inshallah. We open 7 days a week, and we open from 9 to 9. You're welcome anytime you want. You just have to take the first step and the rest on us.
99. Tell me what office opens until 9 o'clock, man, for real. I don't know any clinic that opens until 9 o'clock.
And we name it as
PM, yeah.
We name it as urgent care, so you don't feel shame get into it, because nobody will discover that you're coming for addiction at all.
Exactly.
And we treat you with very privacy, and nobody will know all the
Your information is safe.
Yes, and if anybody asks you why you're here, just tell them I'm coming for urgent visit, and you're not lying at all.
Exactly.
It's an urgent care.
This is an urgent visit. Yes. So the name, alhamdulillah, is easy. You can't be ashamed of coming in here and walking in here. If somebody see you, like, yo, I had a checkup, or I had an urgent care, my stomach was hurting, something. You gotta, you gotta do something. I ain't trying to tell you to lie, but you come in here for urgent care, you are here for urgent care.
If you say I'm coming for urgent visit, you're not lying.
Yeah, you're not lying. Exactly. It's the urgent. Yes. The urgency in taking care of yourself is most important.
Yes.
Alhamdulillah.
Now about coronavirus. Let's first give some introduction about
the coronavirus,
and then let's say what we can do and what we're looking for. We have a disease called URI, upper respiratory tract infection. upper respiratory tract infection, which is caused by over 200 viruses.
Uh-huh.
Before coronavirus, the most common one and the most dangerous one was the flu virus, which thank God now we have vaccine on, and we have vaccine for it, and we have treatment for it. And the flu is the 12th leading cause of death in the United States. So in spite that we have a vaccine and we have a medication, still it can cause death, especially on the people with immunodeficiency or elderly patients with multiple comorbidities. The virus infected them and he killed them. But again, we have treatment now, we have vaccine for it. Coronavirus was one of the 200 that can cause URI. But certain modification happen to the virus, make it very virulent, and virulent means very strong. It gets inside the body, it infects the person, it gives the same symptoms as flu, but it really destructs the lungs and shut down the body.
So its main thing is the lungs?
Yes.
Is that something that
lungs.
it looks for?
Yes, the lungs. But you have to know this. There is no treatment as of now for the coronavirus and there is no vaccination. The government announced that she's working hard to get this done. And she said that she come up with certain vaccine, but still in the testing phase. And by 6 months or 8, we're going to have some sort of treatment, which is
6 months
or 8.
Really?
Yeah, we don't know about the accuracy of this information, but that's what the government announced. Now, coronavirus, it has incubation period. Incubation period means it needs time inside your body to produce the symptoms. So if you're infected today, if the virus goes inside your body today, you will not be sick right away. It will take from 1 to 14 days to produce the symptoms. Now we have to divide the people according to the risk, to the high risk, low risk.
Uh-huh.
You have to know there's 2 categories of high risk people. First category is the people who deals with the virus, which is doctors, nursing, anybody who can deal with sick people. Those are high risk people. The second people, the people who has travel history last 14 days. So if you come from different country, less than 14 days, you're at high risk person.
Uh-huh.
The third category is the people who are not in travel and not really contacting anybody with the virus. All people are exposed to get the coronavirus, but we're saying this is high risk, this is not high risk. Now, what you're looking for in the coronavirus is fever. You must have fever. Fever and upper respiratory tract infection or lower respiratory tract infection means congestion, cough, nasal flu, harshness of the voice. You have to have fever. If there is no fever, there is no corona infection. If there is fever, then you might have corona infection and you have to be tested for. And every single hospital in the United States of America has the test for that.
That's true. I went last night, I went to Henry Ford because, I got the symptoms of runny nose.
Yes.
I thought I had a fever. So I went right away and they tested me for just regular flu. Nothing. They tested for all other stuff. So it's very easy. It takes they told me it takes 10 minutes, but it takes like 45 minutes.
True.
But it's good. You test yourself.
But everything,
you got nothing to lose.
The thing you have to remember is fever. Fever is the key word. Fever could be subjective, that you think you have fever, or it's documented by measuring the fever.
And the fever has to be at a certain number?
Yes, which is 100.4. Anything above 100.4 is fever. 100.4. And that's including everything, including every age. Doesn't matter how old you are, 100.4 is the cutoff for fever. So if you have fever and you have respiratory tract infection, you have to go to the hospital right away and tell them, I heard if I have fever and URI, I have to go to the hospital. That's true. That is one thing. Now, how to eliminate the chances of catching the virus? Well, there is 2 advices and you have to really follow them as much as you can.
Pay attention, please.
Number 1, hand wash. The virus is killed by the detergents and by the water. So if you wash your hands every 4 to 6 hours, that's a good sign that you will not catch the virus.
Or if you're making wudu for every salah,
that's true too.
That's it.
But the soap has to be part of the cleaning thing.
That's right.
The second thing is, after that, is eliminate handshakes. Eliminate handshakes as much as you can. And that's including the fist, including the elbow, including every touch. You can try to eliminate touching.
And when it comes to the Arab, man, they be hugging, they be kissing, they be doing all that love.
You have to eliminate.
Chill, back off a little bit now.
Yes, for the time being, till we get the vaccine, and we have to get easy to apply the vaccine. Till now, we have 6 deaths from the viruses, and all the same state, which is Washington, the state, not the capital.
Oh, there's 6 recorded deaths from the coronavirus in Washington State.
Washington, and all of them about 50 years old, and all of them has comorbidities, and that tells you how strong the virus is.
Mm-hmm.
And you have to be careful. But thank God, in Michigan right now, there's no reported cases or no reported deaths. We wish that we can control it. I think it's again test from God. And we have to really ask Him for forgiveness and ask Him for protection.
It's a trial, definitely.
Right?
Yes, definitely.
And try to take as much as precaution as you can. Don't try to sit with sick people, no matter what. Try to always ventilate your rooms. Try to always wash your hands and eliminate touching people.
Alhamdulillah. So you heard it right, man. This is what the everybody's talking about, basically, coronavirus. Even though I think it's a little bit overrated, they overrated it.
No, actually, no.
But there's no overrating here, huh?
There's no overrating here. The rate of death is so high. We had 1 case, it jumped to 2, it jumped on 6 in less than 24 hours.
Wow.
It is highly
So in
infectious.
comparison with the flu, they say the flu even kills more people.
True, but the flu has vaccine and the flu has treatment.
Oh.
We don't have vaccine or treatment for coronavirus. We know exactly the shape and the models of the flu virus, but we don't know exactly what happened to that coronavirus and change into that strain which can kill people.
Subhanallah. So that's the idea. The vaccine is what we are afraid of. We don't have the vaccine
Or the treatment.
for the coronavirus. We don't have the treatment for it. We know about it.
And that tells you one thing: no matter how strong you are, no matter how many weapons you have, no matter how nuclear weapons you have, how many computers you have, how fast you are in accomplishing goals and destroying countries and building countries, a small virus which you cannot see by your eyes. You cannot see by your eyes. God can modify it and can kill you in a few hours.
Yeah, God can hit you with so many different things that you have no idea about. And that's what Fir'aun, the big pharaoh that is well known in every scripture of every religion, that he was claiming that he was God and stuff. And Allah subhanahu wa ta'ala hit him off with so many weapons that he wasn't even expecting. And to us today, this is a weapon from Allah subhanahu wa ta'ala that might have hit some country or some land or some group of people that were going against Allah subhanahu wa ta'ala and kind of like, just making enemies with Allah subhanahu wa ta'ala. So Allah subhanahu wa ta'ala tested them and gave them a little bit of what they are not even expecting or considering.
Okay, to sum up the things about coronavirus, remember 3 things. I want you to remember that the incubation period is 14 days. 14 days. So if you came from another country more than 14 days, you probably don't have the virus. The second thing is fever, and the cutoff is 100.4. And the third thing is please wash your hand and eliminate touching people. That's it.
Thank you very much, Dr. Mo, for being with us today, giving us this time of your busy day. Alhamdulillah Rabbil Alameen. We only have 1 more minute. All we can do is thank him as dear as possible. Alhamdulillah Rabbil Alameen. We appreciate the information that you have given us. We appreciate you being with us on the Revert channel. This is a channel for reverts, for Muslims, for all of us to gain information, to gain knowledge, to share information that is relevant for us, relevant to our daily things and everything that's been going on in our area, in our environment, in our country, in our city, or whatever. Thank you very much for being with us, and alhamdulillah Rabbil Alameen. You have given us a lot of information that is definitely needed. Everybody, I thank you very much for being with us today. Thank you for being a part of this Revert family. If you haven't subscribed, please do so. We'll have all the information in the bottom in the description, bi'idhnillahi ta'ala, after the live show is over. Take care of yourself, and inshallah ta'ala, we'll be seeing you guys real soon by the will of Allah subhanahu wa ta'ala. Peace.